measles medicine to be administered once an hour.
Actually, I'm not sure it is measles.
How can it be anything other? The chalky white faces, the livid spots, the temperatures of 120 degrees. I've seen it time and again. Measles. Definitely. Open?
Simon, don't!
Rubiola, mainly known as measles. It is a worldwide disease caused by a virus. Since the 7th century AD, it has shown to have its main effect on children, being the root of as many as 2.6 million deaths each year. Measles is an RNA virus which mainly affects the lungs after a person inhales an infected person's sneezes, coughs, or has direct contact with infected nasal or throat secretions. It persists of one main serotype, classified as a member of the genus Morbillivirus in the Paramyxoviridae family. The virus mainly attacks, infects, and multiplies cells in the lymphatic, respiratory, intestinal, and urinary systems, sometimes including the skin and brain. Morbilliviruses occur only as one cross-reactive antigenic types, meaning the virus reacts to a specific antibody for another disease agent, usually during the process of blood testing. Before vaccination was available, the outbreak of measles occurred worldwide and would infect most people by the time of adolescence. However, every 2 to 3 years, vaccinations would reach low coverage, resulting in a plague. In 2014, there were 645 cases of measles resulting in death in the US, around 48,000 hospitalized, 1,000 who suffered from permanent brain damage or deafness, and 7,000 who had seizures. However, also in 2014, there were 57,000 recorded cases of measles in the Philippines, which doubled in China to a towering 107,024 cases. Major numbers are also seen in Vietnam, Angola, Brazil, Ethiopia, and Indonesia. In addition, measles is also known to be fatal within monkeys, who can also have a monkey-to-human or human-to-monkey transmission. Measles is spread by the coughing, sneezing, or direct contact of an infected person by airborne respiratory droplets. The virus can remain active and contagious in the air or on infected surfaces for up to 2 hours. Once a person is infected by inhalation or direct contact, it can be transmitted to other people 4 days before and 4 days after the rash erupts. The process of transmission begins by entering the host through the mucous membranes, body wounds, or the oropharynx. The virus will then perform multiplication, spreading throughout the reticuloendothelial system, where more multiplication takes place. Here, the virus infects one of the body's main defenses, the macrophages. The virus will then reprogram the macrophages to begin a faster reproduction of the virus throughout the body. However, the natural killer cells will then disinfect the macrophages once alerted of the infestation, killing the macrophages once it receives the messenger protein. 10 days after this process takes place, all symptoms and signs disappear. However, after so many macrophages are killed by the natural killer cells, the macrophages alert the dendritic cells to produce more cells for defense, which will collect B cells, killer T cells, and helper T cells. Yet, the dendritic cells will become infected with the measles virus before transporting to the lymph nodes in an attempt to alert the defense cells, instead spreading the measles virus onto them. Now, the body will have no way of defending itself against the virus. The measles will infect the organs such as the spleen, the intestines, the liver, and the lungs. At this stage, other bacteria can enter the lungs and develop, usually, pneumonia. The infamous, typical measles dotted rash is seen. If the virus is capable of spreading onto the brain before treatment, the chances of death are between 20 and 40%, and permanent brain damage is possible. However, some uninfected dendritic cells will then prepare the memory plasma cells, memory helper T cells, and memory killer T cells to produce billions of antibodies to destroy the sites of infection. After 2 to 3 weeks, recovery is highly possible. Symptoms for measles usually begins 8 to 14 days after exposure to the virus. The main and most obvious symptom is a rash, which occurs 3 to 5 days after the first signs of sickness and lasts from 4 to 7 days. The rash usually begins in the head, slowly spreading out throughout the body as the virus multiplies. This itchy rash, called complex spots, appears as a flat, discolored area and solid, red, raised areas that later join together. The first common symptoms may also include high fever, which lasts 4 to 7 days, a runny or stuffy nose, sensitivity to light, sneezing, muscle aches, coughing, watery or red eyes, and small white spots inside the cheeks. In typical cases, the clinical picture is diagnostic. Atypical cases or cases following previous vaccinations are diagnosed by isolating the virus in cell culture by direct smear of cell-containing specimen, by detection of RNA with the polymerase chain reaction, or detecting specific immunoglobulin M in the first serum at the time of rash with a rising titer of immunoglobulin G antibodies in the second serum. A swab of saliva or a blood test is usually taken and measured for measles-specific immunoglobulin M. However, the virus can also be identified by its signs and symptoms. Despite there being no specific treatment for measles, acetaminophen, paracetamol, and ibuprofen, bed rest, and humidified rest is recommended to alleviate symptoms. Some children with low supplements of vitamin A may also have recommendations of it for a lower death risk. Anything which can make the patient more comfortable, such as a darkened room to reduce eye discomfort, or dampening of the secretions of the skin, should also be taken into consideration. Measles prevention is acquired with the vaccine, which is usually given to babies between 12 to 13 months old. Children are given a second vaccine between the ages of 3 and 5 years old to strengthen the prevention. Due to complications, always remember some people should not get vaccinated due to chemotherapies, allergies, pregnancies, and HIVs. So when you are vaccinated, you not only protect yourself from measles, but you also lower the risk of this virus to those who cannot get vaccinated. Vitamin A supplementation is also encouraged to avoid complications if measles is developed. Finally, maintaining good hygiene and covering your mouth and nose when coughing or sneezing should always be performed to reduce the risks of getting a virus.